A new study claims that masking did little to curb the spread of COVID-19. Data comes from a group of 12 researchers from around the world using 78 studies during the outbreaks of COVID, H1N1, and the flu. Joining us to talk more about this is Dr. Kumar. Good morning, Dr. Kumar. How are you?
Doing well. How are you, Amanda?
I'm doing okay, thank you.
Good.
I guess we should just break down the study if we can.
Sure. You know, this is not the best study. It's out of Cochrane Library. I've never heard of this journal before, but it's getting headlines across news sources that masks don't work. And if you look at the study, this was already a study published in 2020. 72 studies have been published over the last 20 years, the H1N1, the flu epidemic, SARS, and all that. And in 2020, they showed that mask mandates don't work. But if you remember, we didn't have mask mandates a whole lot back then, so adherence was poor. The quality of the evidence, because all retrospective, was poor. So what they did was republish that study, but added 6 more studies from the COVID era, one from Mexico, one from the United States, and 4 from Europe. And they added those. They didn't break it down as to what those 6 studies showed in and of themselves, but they added it to the 72 studies, claimed to have 600,000 patients, and showed that the data that they showed in 2020 continued to prevail that masks don't work. And so this is just a very poor quality study done in a haphazard way, that if you had an a priori idea that you were going to show that masks don't work, this is the ideal study. This is how you would do it to show that they didn't work.
Some of the study authors will admit that there are limitations and a risk of bias.
Yes, there's a tremendous bias in here because it's all retrospective, right? What they're showing is that they have no idea about adherence, and that's what they keep claiming. We don't know if what adherence is a big problem with this, and there's a lot of biases when you do retrospective studies, like, did you wear a mask, did you don't? You're checking a box, I wore a mask, did I get infected? I got infected. That's not very scientific. You know, it's very retrospective, and you can't really count on this kind of data. And so there's a lot of bias in these, and there's a lot of guesswork in this. And to their credit, they claim that. And I was like, you know, this is poor quality evidence. We can't be sure if these things work, but this is what we show when we do the study in this way. And, you know, adherence, I keep pointing out, adherence is a big issue, and of course it is. You know, it might be true that masks mandates don't work because adherence is not dependable. Yes, it's like vaccines. You know, if you tell the population to get vaccinated and they don't get, most of them don't get vaccinated, the vaccine is not going to show any effectiveness.
Adherence being somebody saying, yes, I am going to do this. Yes, I am going to adhere to these rules and regulations.
Right. So if you have a mask mandate, it would work if everybody wore a mask. You know, that's how you avoid the spread of respiratory viruses. If everybody wears them, then you can lower the potential of spread. But if only a third of the people or half the people wear them, then there's still spread going on, and you're going to find a lot of infection in the community. And the information that you'll take home is that mask mandates don't work because half the people didn't wear them, and it's similar to vaccines and things like that. And so adherence wasn't accounted for in this. They just said, well, these are mask mandates, how did they work? And so it's a very poor quality study. And so what's important is for the individual at home who has an immunocompromised state, who's flying on an airplane, who's going to a crowded facility, who might feel at risk, you know, and chooses to wear the mask. Yes, this is still protective. You shouldn't take home from this message that these masks aren't going to protect me. I'll just go out there because they've proven that masks don't work. This is not that study. That's not the headline. The headline is that, you know, if you do a poor quality study, you can't really interpret it.
And as a medical professional, why do masks work?
Well, these are respiratory viruses. They're spread, you know, in the air. And if you protect yourself and if you have a barrier to these viral particles, I mean, it's very difficult to prove, but theoretically, and we have to do prospective studies, in fact, to prove it. I don't have proof that masks do work, but I don't count on this as proof that masks don't. But if you prevent the inhalation of these small viral particles, you can protect yourself. Now, a mask, you know, in theory, will not eliminate it. We all have heard of people that wear masks that still get infected. This is not the be-all, end-all. This is not the ultimate way to prevent a mask, but it will improve your chances of not getting infected, particularly if you're susceptible to having the worst outcomes from disease to wearing a mask.
Dr. Kumar, as always, we appreciate your time. We've run out of time. It's a big topic. If you have a question for Dr. Kumar, email us at askdrkumar@gmail.com. You can also check out his website, drkumar.com. We'll be right back.